We are two health enthusiasts. We are real black women. We are about to have some real conversations about the good, the bad, and the ugly about our health. We are too fine to die. Hey guys, this is Dr. K and my beautiful co-host, Coach K, and we are health enthusiasts, but we're really two real black women having real conversations about the good, the bad, and the ugly about health in our community. Because at the end of the day, we are all too precious and too valuable not to take our health seriously and live our absolute best life. So, Krystal, what will we be discussing today?
The real.
Okay.
Something that needs to be talked about, and it's often run from. We are talking about mental health, especially mental health in the black community. It's amazing. I don't know where the stigma first started, but it's scary and sad how many people are afraid. They hear it and they're like, oh, I don't need it. But when we look at the history of past events, current events, and we're going to talk about all of them today, it's evident that there's help that's needed. And I think, so can I start with what my goal is for this?
Yes.
Okay. So my goal, I'm going to give y'all the punchline in 20 seconds in the beginning. But I really want people to realize that seeing a mental health expert is like going to anybody. It's like everybody who comes to you, you know, people come to me, people who go to their dentist, they go to their orthodontist. So if you know that something's not feeling right, it's okay. That's my major message, not message. I guess it's a message and a mission all together. But it's okay. And it's your responsibility to fix what's not feeling right. You know, if I cough too much, I'm going to go to the doctor. You know what I'm saying? If I'm bleeding too much, I'm going to the doctor. But a lot of times, people don't want to acknowledge the cut and the bleeding that's on the inside because they feel like that means something's wrong with them. And it's okay to have something wrong. We all got something wrong with us. You know, so that's really where, and I'm so glad we're having this conversation. I'm glad that when we talked about, you know, it was interesting how when we first were like, oh, what should we talk about? We both were like, we have to talk about mental health. We have to. It's imperative.
And I think you're right. It's the stigma. It's a stigma that I think it's becoming less stigmatized, but I think it's still something that is a black cloud over our community. Yeah. Because you can go back, you know, I think everything goes back as far as slavery because it's like ingrained, but you had to be strong. There was no time to be weak. Like, what are you crying about?
Suck it up.
Exactly. What are you sad about? You know, so-and-so getting lynched, so-and-so getting whipped. We got, you know, all these kids to feed, daddy gone. I mean, there's no time to have feelings when you just have to survive. It's like you're in survival mode. And I think now that we're in a time where life is a little bit easier, where we don't have those same life and death demands in the same kind of acuity as back then, we do have more time to think. Which is why I think some of these like millennials are so, I don't want to call them, it's not soft because that sounds judgy. But everything is a feeling.
Soft.
But that's not bad.
Cream puff.
but that's not bad because that's what we're talking about. It's like, you know, being comfortable to express that.
Yes.
And I think that I do applaud them for being more comfortable saying how they feel. I don't agree with them thinking that everybody should care how you feel because that's not how the world works. But you should feel comfortable to kind of say, I feel sad, I feel scared, I feel whatever it is, because bottling it up doesn't help you. And your mind can control your body. There's a lot of chemical reactions that go on, stress hormones and such, that can physically make you ill when
and
you have
you.
these, when you have these processes that are not being hashed out, resolved, treated. You know, like you said, if somebody had a broken leg, you wouldn't be like,
oh, I'm cool, I'm just gonna drag
like
it.
you don't need that cane or you need that cast. You know, if someone is hurting mentally, there are treatments for that. And I think we need to be, we shouldn't classify people as broken if they have mental health challenges. So, I mean, I you know, I came to terms that I have pathological anxiety. And I think I had anxiety as a kid. My mom died when I was 13, so I have like separation anxiety because it was kind of like I went to school one day and I came home and she was not around. And then the older I got and I went through med school and residency, and then now, you know, 13 years as like I'm the captain of the ship and I have people's lives in my hands, my anxiety is like on a million.
Yes.
Because I know that there are so high stakes, you know, in my everyday decision making that my anxiety has just gone like out the roof. Yeah. But it got to a point where I was making myself sick because when I'm anxious, I don't eat. My stomach hurts. I'm not sleeping well. My relationship changes. I don't want to talk. Yeah. You know, I would sit in my office and just cry, and because I felt like I was like dying, like my chest is beating out of, like my heart is beating out of my chest. I don't know how to articulate how I feel because everyone outside of my office door thinks that I'm a strong surgeon.
And you got it all together.
Yeah. And I still want to preserve that because if they panic, I can't panic, you know? And I was like, I need to get back into therapy because I had stopped for a while because my therapist I had for years, I think she moved. And it's very difficult once you've set up like a long relationship and they know who Boo Boo and Kiki
and you don't have to go back through the lines like,
I'm like, I can't start back over.
It's like not going back to dating after you've been married too long. I'm not gonna tell you what school I went to.
But it's got to a point where I was just like, oh no. Like I'm not, like I feel physically ill and I'm not functioning right. So I started seeing my current shrink, Dr. G, shout out to you. And it started with just therapy, you know, me being aware or more cognizant about why I feel, like what are my triggers, you know, because he calls it catastrophizing. I fall into worst case scenario. That's like that's my default. And you know, I still do it, but I know how to kind of talk myself out of it a little bit. I can reason out like, is this real? Is this my reality? Or am I tripping? You know, and most of the time I'm tripping. And then, but it still wasn't enough. I had some major work changes happen all at once, and it wasn't enough to keep me calm. So I did start a medication last year, and I don't think that everyone needs to do that. But again, I can't afford to be crying in my office, you know, for no reason when I have work to do and patients to see. And me starting on medication helped me just have a lower baseline of just stress and anxiety. Hey guys, I'm Dr. K. I'm a bariatric surgeon and co-founder of Pro Black Health. I've been a doctor for 13 years practicing, so I know that you should not wait until you're sick to be concerned about your health. Did you know that 92% of Black people are vitamin deficient? And that's why we created Pro Black Health Vitamins, to help fill in those nutritional gaps that are often made by our diets. So not only we are a vitamin company, but we are a movement where up to 50% of our profits go towards nonprofit initiatives that focus on eradicating healthcare disparities in the Black community. So I welcome you to try us at Pro Black Health, PROBLK Health.com, where an investment in yourself is an investment in the community. I could think more clear. I could still see what was going on, but it was like my body wasn't like revving up to 1,000,000 every time and everything like haywire. So, and then I was afraid to tell people at work because I was like, well, you know, what are they gonna think about me? And then I was like, you know, excuse my French, fuck it. Because everybody has their journey. And when I started telling people, you know, I started back with my shrink once a month, I started on medication. If I look stressed out, it's because I have anxiety. It's nothing wrong with you. Give me space. It helped them better communicate with me because they knew when to like kind of back off or not bother me. I could joke about it, you know, and it wasn't like this dirty little secret that I'm having. And then, you know, I found out everybody in the room was doing something. So it was like I wasn't the only one. Oh, we have a good old kiki haha about our different therapy sessions and that. So I think we need to, you know, destigmatize the what will people think. And, you know, am I crazy? You know, okay, I'm crazy. But like I said, I'm not dangerous. You know, and there's a difference between thinking off because I have some off thoughts, but I'm not gonna go around stabbing you and, you know, cutting that kind of clown. But it's okay to be different, you know. I'm a very different thinker. You know, I'm easily stressed, but I figured out how to manage it. And that was probably one of the best things I've done for myself in the last 5 years, to be a better person holistically.
Yep, and then that's the key, to address and acknowledge what's going on. So it's interesting hearing you talk. It makes me think about one of my friends. He was diagnosed with bipolar disorder. And it was a conversation about, you know, does he have it? His wife's like, no, he doesn't. And I'm like, whether that's the diagnosis or not, that does not change who he is fundamentally as a person. If anything, as you said, now we understand how he thinks and processes so that we can maneuver differently. It's not about expecting him to be different or changing anything. It's just so we can know. But when you talk about stress, child, it almost took me out. And I had no idea that it was stress. So in 2016, I'm preparing for my second figure competition. I'm like, I'm gonna do another one. And one day I was walking to lunch. And
What's a figure competition? I think I know, but some people may not know what that is.
So figure competition, there are different levels. There's bodybuilding, so you can do bikini, you can do figure, you can do pose, like all of that stuff. So I basically was in the category where it was just me toning up, where I'm not too feminine but not too hardy. It's like right in the middle. So this is my second show. I'm gearing up for it, and I'm walking to lunch, and I realized that my right leg was numb. And I was like, damn it, I think I got sciatica. So of course I go to the doctor. They're like, yes, you have sciatica, chill out. I'm like, okay. So, but I'm like about a month and a half, 2 months out from my show. So I'm like, maybe if I rest for 2 weeks, I can get back to it, right? The next week, all of a sudden, now my left hand is numb. So it went from my right leg to my left hand. And I'm like, something's not right. So now, of course, I'm going to the doctor. Oh my gosh. First time I ever had to get an MRI. Like, I'm not claustrophobic by any means, but having your head put in a cage and all of that, I was like, wait a minute. The second time I had to get an MRI, I was like, can y'all give me some drugs, please? Like, y'all got to calm me down. But said all that to say, did all these MRIs, all this blood work, everything comes back spotless. Everything. And so it was the neurologist who was like, okay, well, let's talk. Like, what's going on with you? And it turns out it was stress. It was stress. There was a lot of stuff going on. Mainly my son had just gone off his freshman year at college. You know, it was just like, that was a change. So it was so bad. Let me tell you how bad it was. It started in September. From September until February. February. I could barely go into work. I could barely drive. I could barely walk through my house. Like going up and down my stairs. I slept in my family room because, and that's a shame, I'm gonna cry, but my body was breaking down. And it was crazy because I was like, what is wrong? Because they thought I had MS. You know, like it was really that bad where it was scary. And then once they said, okay, something's going on, your numbers are perfect. Everything. I think the only thing that I almost had off was my vitamin D was like a little low. And so that was around the time I started therapy. And just being able to go and express and like really, you know, because just in general, everybody has trauma, everybody has stress. But, you know, being a woman, being a black woman, being a wife, a mom, a sister, a daughter, we're taking care of so many people. Like my husband jokes and calls me the cloud. And I'm like, who gets to be my damn cloud? Why I gotta be the cloud for everybody else? And that can become a lot. Like it becomes a lot. And it was like once I just started talking to my therapist and understanding what was going on, like it's amazing how just having the answer or acknowledgement, it makes things better. Because then I didn't have that stress of what's going on. It's like, girl, you stressed, so what stress can you get rid of? Because I'm not about to let stress take me down. It's not, you're not about to take me out for all this other stuff. So I'm so grateful, and I've been going to therapy consistently for about 7 years now. And I remember one day, I knew right before I walked in, I was like, you have to post. And I did my session. As soon as I got in the car, I didn't even pull off. I sat in my car and I typed out this long post, like my name is Krystal and I'm in therapy. And I just started listing. And I'm so glad I did, because there were so many people who inboxed me who were like, I've been thinking about it, but I've been scared. I've been thinking about it, but I've been scared.
Yep.
And that's why I'm so open about. I love therapy. I go next week. Shout out Dr. Tamara. Hey, but look, and I can tell when I haven't gone. I go every 2 weeks, and I can tell when I need a touch up, like wait a minute. But people are like, you just paying somebody to be your friend. You damn right, because I could be stressed out, and I could call you, and you're going through stress, and as soon as you pick up the phone, you're like, girl, and so what I'm carrying, I don't even get a chance to talk about because you just unloaded on top of it. So now I know I got me a good 60 minutes.
Exactly.
And I get to tell all the things with no judgment.
Exactly. So it's not even like a friend.
No.
Because your friend, it's almost like being a tea kettle. That's like, you need to pop the pressure every once in a while. It's like steeping.
Yeah.
Because even the closest people in your life, sometimes you can't tell the deepest, darkest fears. Yeah, exactly. Dirt, what you're ashamed of. But those things are eating you up, and you want to tell somebody, but you can't tell anybody. Yeah. And you know that your therapist is someone objective. They don't really have a relationship with you outside of listening to you and giving you advice. So you don't have to filter anything, I don't got to worry about hurting your feelings. I don't got to worry about what you're going to think, after I say this, after I pour my soul out. So it's like, for me, it's like, I get to steep my kettle, once a month, because I bottle things in, I don't like confrontation. There are thoughts that I'm not proud of, and I'm like, should I be having them? But it's like, I can talk about it, and I got it off my chest, and then he'll be like, yeah, that's cuckoo, or no, it's okay for you to feel like this. So how do we address it with the people that you need to be addressing it with? Because on my own, I'm just like, I just rather not say anything.
Yep.
So you're not paying for a friend. You're paying for like a voice of reason.
Yeah. Even when you don't want to be reasonable.
Exactly.
You be like, shh. I be telling her, like, I know you telling me what I need to hear.
Exactly. But it's just getting it off. And sometimes you even got to say nothing back. Like, Dr. G, thank you. I got to tell you, I did some bullshit this week. And I knew I shouldn't have done it because I keep doing it.
Look.
But let me just tell you, because I can't tell nobody.
I come in and tell her, I be like, you ready? Susie Logan, she like, I'm like, I'm good. You ready? She be like, uh-oh. I'm like, oh, buckle up. We about to have fun today.
And you just kind of like getting that off your chest, because you just, your thoughts will manifest into physical ailments, symptoms, illness, and you got to find a way to remedy that. So we have to figure out, how do we make it more of an open conversation, and not even, oh, you go in therapy, tell me what you tell your therapist. Yeah. I don't want to know, because I would probably be scared what's going on in your head and your head. But but just get it off, you know.
And you mentioned something else. Like, we have to stop really making people think that they have to be strong. And even and we can admire our strong friends, but check on your strong friends. Because we get tired too. Like, we can only be strong for so long. And I'm saying we, because I'm one of those. I am not the greatest with asking for help. I'm so used, like my friends used to joke and call me somebody, because they were like, we need somebody to do so. It always ended up being me. Like, stop, y'all know who gonna do it. Because, I don't, it's not that, I don't like to see people say, I'm a nurturer. So by nature, if I see somebody need something, I'm give. And I'm an empath.
Yeah.
And that can wear me down. And so that's why at this stage in my life, child, look, menopause been getting on my nerves, but I love that part. Because I say no quick. I'm like, nope, you want to do, nope. And I don't feel bad about it, because I know that's what I need right now. Hey, I am Krystal Taylor, the owner of Fitness is Not a Game. I am your health and fitness coach who specializes in helping women over 40 lose weight without dieting or exercising for more than 30 minutes at a time. It is my personal mission to help at least 1 million Black and brown families change the trajectory of their medical histories, because we are not predisposed to these preventable diseases. So if you know that you need help, you're looking for a coach, make sure that you send me a message. You can go directly to fitnessisnotagame.com dismantling.com, and I got you. And if you're a foodie like me, because when you work with me, you are still going to eat, you're going to move, you're going to love yourself. Make sure that you go to my Amazon page, look for In the Kitchen with Krystal, where I make meal prep easy yet delicious. You are going to love the body that you get. And I don't feel bad about it because I know that's what I need right now.
Exactly.
Like, and anybody who's upset about that, then they're not for me right now, because if I say no, I need to say no. And I think we need to give people grace for that and check on our strong friends and our strong siblings and strong cousins, because it's a lot. It's a lot. And I really want people to admit when they just can't take anymore. And it's okay. We shouldn't be expected to take home the world. No.
It's very unrealistic. But I think my takeaway point, or what I want people to kind of know, is sometimes you don't know where to start.
Yes.
So, you know, go on Google and just put in whatever words and see what happens. But if you have a primary care doctor, ask for resources. Look for psychologists in your area. I mean, you can even dwindle it down to, you know, black, female, male, because males are an issue. But the first step is, however you feel most comfortable, research a resource. And it might take more than one therapist for you to feel comfortable.
Oh, I'm so glad
but
you said that.
We need them to know that as part of, like, how do we start fixing this? You got to take the first step, and it's okay.
And for those who feel like, you know, I don't have the money for it. Yeah, we do. It's an investment, and there are many resources out there that are like affordable care type of services. So you can look it up, and you pay based on your salary, what you own, I mean, what you have. So for me, I would say, go look, and like you said, don't try one, because most people are already afraid of therapy anyway, so they'll find any reason to get away from it, like, nope, it didn't work for me, but you're looking for an out. Keep trying. You have time. You know what I'm saying? Like, you know, you don't stick with your first barber or hairstylist. You play around with the people. You know, if you can put all of that effort into how you look on the outside, why not put
all that
same
money?
effort?
So I want to hear about money, but
they'll spend all that money on their hair, nails, day drinking trips, and all that stuff, but then act like they can't go see a therapist for doggone $60. You know what I'm saying?
So we can talk about that part next time. The point is just start.
But just start. And don't be afraid of it, because, you know, I always tell people, speak out, because you never know who you're going to impact and who's listening and who needs you. And that's why I'm so glad we're having this conversation, because people need to be okay with saying that they're not okay. I'm going to say this again. I said it earlier, I'm going to say it again. It's okay to not be okay, but don't sit in that alone. There's so many resources out there, so many options for you to get some help so that you can live this thing called life. That's the whole goal of this, right?
Because you're too fine to die.
Look, that's what I'm saying.
You are too dope.
Fine
you're too
to
amazing
die.
to suffer. So
you said it all.
You said it all.
You said it.
Okay. So until next time,
we'll see you on Too Fine to Die.